Yes, dogs have an extraordinary sense of smell and heightened sensory perception, which allows them to detect various health conditions in humans. Some health issues are detectable by dogs due to changes in human body chemistry, pheromones, and scents that we give off when we are ill. Here's a detailed list of health conditions that dogs have been known to sense, along with explanations of how they do it. 1. Cancer. Dogs have an acute sense of smell, capable of detecting specific odors associated with cancer cells. Cancer cells release unique volatile organic compounds, or VOC, in the bloodstream, which are then excreted through breath, urine, sweat, or skin. Dogs can be trained to sniff out these compounds. They can detect conditions like lung cancer, breast cancer, prostate cancer, skin cancer, colorectal cancer, and more. Some studies show that dogs have been able to detect breast and lung cancer from breath samples with impressive accuracy. 2. Low blood sugar, also known as hypoglycemia. Dogs can sense the drop in glucose levels in a diabetic person's body, often by detecting a change in scent. When blood sugar levels fall, the body releases a distinct odor, such as acetone, through the breath or sweat, which dogs can pick up on. This is especially relevant for people with diabetes, both type 1 and type 2, who are prone to sudden drops in blood sugar. Service dogs are often trained to detect and alert their owners when they are experiencing hypoglycemia, giving them time to treat it before it becomes dangerous. 3. Seizures, including those caused by epilepsy. Dogs may be able to sense seizures before they occur due to changes in scent or behavior that are not fully understood. It's thought that humans may release specific pheromones or experience changes in body chemistry before a seizure. This can be crucial for individuals with epilepsy and other neurological conditions causing seizures. Some dogs can warn their owners up to 15 to 30 minutes before a seizure happens, giving the person time to get to safety. 4. Migraines. Dogs can sense changes in body odor or even behavior when a person is about to experience a migraine. There may be a slight shift in the person's scent due to hormonal changes or the release of certain chemicals in the body that dogs can detect. This is particularly helpful for those who suffer from chronic migraines or severe headaches. For example, dogs may show signs of attention-seeking or attempt to comfort their owners before a migraine starts. 5. Infections, whether bacterial or viral. Dogs can detect infections in humans by sensing the changes in body odor caused by the presence of bacteria or viruses. For instance, when the body is fighting an infection, it may release certain VOCs that are unusual, and dogs can pick up on these. This can be crucial for conditions like urinary tract infections, skin infections, or other infections caused by bacteria or viruses. There have been reports of dogs detecting urinary tract infections or even infections in diabetic patients by alerting them when a change in smell occurs. 6. Stress or anxiety. When a person experiences stress or anxiety, their body releases certain hormones like cortisol and adrenaline. These hormonal changes can alter the body's scent, and dogs are incredibly sensitive to these changes. This makes them particularly effective in supporting conditions like anxiety, panic attacks, and stress. For example, dogs are often trained to support individuals with anxiety, as they can sense when a person is becoming anxious or stressed and may respond by providing comfort. 7. Panic attacks. Dogs can detect the physiological changes that accompany panic attacks, such as increased heart rate, rapid breathing, and changes in sweat. This triggers a scent change in the body that dogs can pick up on. Conditions include panic attacks and PTSD. Service dogs can provide emotional support or alert their owners when they detect the onset of a panic attack, helping them to manage the situation. 8. Pregnancy. Hormonal changes. Dogs can detect hormonal changes in humans, such as an increase in estrogen and progesterone levels, which occur when a woman is pregnant. This leads to a subtle change in body odor, which dogs can sense. Conditions include pregnancy, especially in the early stages when hormonal changes are most prominent. Dogs may show signs of heightened attention or affection towards a pregnant woman, possibly sensing the hormonal shift. 9. Parkinson's disease. Dogs can detect Parkinson's disease through a unique change in the person's scent. Some researchers believe that the condition alters the body's natural odor, particularly in the skin, and dogs are able to detect these changes. Conditions include Parkinson's disease, especially in the early stages. There are studies suggesting that dogs can sense Parkinson's disease even before a person is diagnosed, sometimes even years in advance. Allergic reactions. Dogs can often sense when a person is having an allergic reaction due to the changes in their scent or behavior. This is particularly true for severe allergic reactions, like those caused by food or bee stings, which can lead to anaphylaxis. Conditions include food allergies, insect stings, and allergic reactions. Service dogs can be trained to alert their owners or get help if they detect the onset of an allergic reaction. Heart problems, such as a heart attack. Dogs can sense changes in body odor, which may occur when a person is at risk of a heart attack. This is often due to the release of certain chemicals and hormones, like adrenaline, during a cardiac event. Conditions include heart attack, cardiac arrest, and arrhythmias. Some dogs can sense when their owner is experiencing heart distress, or even detect early symptoms of heart problems before they become acute. Dehydration. Dogs may be able to detect dehydration in humans by the change in the person's scent, which can occur when the body is not properly hydrated. Dehydration can alter the odor of sweat and breath. Conditions include dehydration and electrolyte imbalance. While less common, dogs can sometimes alert to dehydration, especially in individuals with specific medical conditions that predispose them to it. Diabetes. Low blood sugar? Your dog might know before you do. Dogs can perceive changes in blood sugar levels, making them great companions for people with diabetes. They can detect the scent of ketones, produced when blood sugar levels drop too low, alerting their owners to take action before a hypoglycemic episode occurs. Migraines. The onset of a migraine can be uncovered by dogs by sensing changes in body chemistry. They often alert their owners, giving them time to prepare. Some dogs can recognize the early signs of a migraine, such as changes in serotonin levels or other biochemical markers, and warn their owners by displaying behaviors like pawing or whining. Tuberculosis. TB is a serious infectious disease that dogs can spot by sniffing individual samples. Their ability to identify the scent of Mycobacterium tuberculosis, the bacteria causing TB, can be instrumental in areas where access to medical testing is limited. Early detection by dogs can lead to quicker treatment and reduce the spread of this contagious disease. 16. Epilepsy. Before an epileptic seizure, dogs can observe subtle changes in their owner's body, giving a timely warning. These amazing animals can notice changes in body chemistry and behavior that precede a seizure, often alerting their owners 10 to 20 minutes before it happens. This warning allows individuals to find a safe place and take precautions. 17. COVID-19. Believe it or not, dogs have been trained to detect COVID-19. Their noses can find the virus's unique scent, even in asymptomatic cases. Studies have shown that trained detection dogs can accurately identify the presence of COVID-19 by smelling samples of sweat or saliva from infected individuals, offering a non-invasive and rapid screening method. 18. Parkinson's disease. Dogs are very keen at sensing changes in body odor associated with Parkinson's disease, sometimes years before symptoms appear. Research has shown that dogs can catch specific scent markers related to the disease, which can aid in early diagnosis and potentially slow the progression of symptoms with early intervention. Lyme disease. This tick-borne illness can be discovered by dogs by identifying changes in scent. Trained dogs can recognize the unique scent of Borrelia bacteria, which causes Lyme disease. This helps to identify infected individuals early and reduce the risk of severe complications through prompt medical intervention. 20. Malaria. In regions where malaria is prevalent, dogs can sniff out the disease with impressive accuracy, aiding in early detection and treatment. Trained dogs can discern the unique scent of malaria-infected blood, helping to screen individuals and prevent the spread of the disease, especially in areas with limited access to medical testing. 21. Narcolepsy. Narcolepsy attacks can be dangerous, but dogs can feel them coming. They pick up on the subtle chemical changes, warning their owners in advance. These service dogs are trained to notice the signs of an impending narcoleptic episode and alert their owners, allowing them to find a safe place to rest and avoid potential injuries. 22. Urinary tract infections, or UTIs. Dogs can detect UTIs by inhaling urine samples. Their accuracy can sometimes rival medical tests. Trained medical detection dogs can identify the specific odor of bacterial infections in the urine, which can help diagnose UTIs early and ensure prompt treatment. This ability is particularly beneficial for individuals who experience recurrent infections. Dogs have an impressive ability to detect changes in human health, often before we are aware of the issue ourselves. Their acute sense of smell allows them to detect minute changes in body odor, chemical imbalances, or hormonal fluctuations that are associated with various health conditions. Because of their keen sensory abilities, many dogs are now being trained as service animals to assist people with specific health concerns like diabetes, epilepsy, and anxiety, and to help detect serious conditions like cancer and infections.